treat their water. And in this respect, we use solar, which is abundant and which, especially in Africa and in Kenya in particular, we have a lot of sunlight, so we use sunlight to treat water.
Now, For Life Solution is all about providing safe and clean drinking water. Maybe on AMREF, what does AMREF Health Africa do, and maybe something like that?
Thank you very much. First is to appreciate and thank the station to having welcomed us to have this conversation. AMREF is an international, the largest health development international NGO, headquartered in Kenya, and we are present in 35 countries in Africa. And we have our vision, which is lasting health change for Africa. And we have a mission, which is transforming the community's health through primary health care, which is majorly focusing on women and children, as well as youth, and of course encompassing other social determinants of health. At AMREF, we address all the health, public health issues, ranging from the WASH, the public emergencies, health of women and children and youth, as well as other social determinants of health.
Maybe how does the partnership between For Life Solution and AMREF Health Africa help in navigating or curbing the challenges that people are facing due to floods, in terms of distributing the sour bags that you guys have done in collaboration with the For Life Solution, and specific challenges of providing safe drinking waters to the community? Dr. Benjamin.
Yeah, thank you for that. Yeah, we understand the current situation, and through our partnership with AMREF Health Africa, For Life Solutions has donated 1,000 sour bags. And let me shortly describe what these sour bags are, because these are bags which are made of special plastic material, which when you put your water, which may be contaminated with bacteria, and bacteria, we mean bacteria which causes cholera, diarrhea, and these other waterborne diseases. And when you put that water and you take it outside your house where there is sunlight, and you allow it to stay for 4 hours, your water will have been disinfected, or all the bacteria and the germs, which that is bacteria, virus, and protozoa, will have been killed from the water. So after 4 hours, your water is clean to be used for drinking purposes. So this partnership in the midst of the flooding situation, it is strategic because it addresses the issue of contamination. You know, after flooding, we have latrines, you know, the pit latrines, when they have all mixed with the water, yeah. And even sewer system, if they are mixed with the water which people consume, you find that it is waterborne diseases like cholera being reported. So these sour bags will people will use, they will use them and be able to treat this water so that the bacteria which is in the water is completely removed, and you find that the sour bags can be used for 1 year. So
maybe on your side as the AMREF Health Africa, how does the partnership work between you and the For Life Solutions in terms of, like, they have distributed 1,000 sour bags. Through them, you've been able to get 1,000 sour bags to distribute to the communities. Maybe how is your partnership working?
Thank you very much. Yeah, AMREF is focusing on making sure that there is continuity of service of the health of the communities. And we know during the flood situations, a lot of infrastructure, water, sanitation, and hygiene facilities have been disrupted, have been destroyed. And there is a possibility that the water that these poor populations are taking is contaminated. And these sour bags are coming handy to make sure that this contaminated water is treated at the point of use at the household, so that the communities, this household, are able to access safe water and be able to make sure that they avoid the outbreaks of the waterborne diseases. And layering on what AMREF has been doing, working with the communities and also through the government, these structures are the ones that we are utilizing to make sure that we reach and distribute these solutions, so that the communities, the structures is utilized, that the system is aware of where the needs are needed most, and these are the people that we are reaching.
Dr. Benjamin, before I cut you short, maybe you've talked about distributing 1,000 bags, and I trust they cost 750,000 Kenya shillings.
Yes.
Maybe do you guys distribute these bags to the communities for them? Are they buying them, or you're distributing them freely?
As a For Life solution, during this time of the flooding situation, we have donated 1,000 sour bags to the flood victims. However, because you know the people affected are many, and we are calling upon partners like AMREF has done. We are calling upon more partners to buy from us, so that we can be able to reach these people who have not yet been supplied with these water treatment solutions during this time.
So it is AMREF who are buying from the For Life solutions?
No, we have given for free, okay, as For Life solution.
Mm-hmm.
Yes.
And maybe the areas that you are targeting to distribute these sour bags?
Yes, with in this partnership, we are targeting the Tana River, which has been highly affected by the flooding situation, and whereby many cholera cases have been reported in the country, and also the Mai Mahiu flood victims. Mm-hmm. Yes, for this particular donation.
Mm-hmm. Coming to you, Mr. Solomon, let's talk about water, accessibility, sanitation, and hygiene promotion. We are talking about you guys distributing the sour bags in order to give them clean and safe drinking water. As far as sanitation is concerned and hygiene promotion is also concerned, maybe what's the partnership? What is the plan of the partnership?
Absolutely, thank you very much. AMREF aims in its intervention on resilient and health systems strengthening, mm-hmm, and in addition to the short-term response to the floods issues, including the water treatment through the sour bags, we are acting in a very integrated manner, where we have been working with the governments and other actors to make sure that other aspects, other issues of public health is addressed. These include the sanitation aspect, where we are engaging communities through risk communication, and of course directly making sure that the communities are participating in this, mm-hmm, so that they get to understand on the preventive and control measures that they can take, so that as we prevent the diseases and control the diseases, at the long run, the communities are well empowered to make sure that they take their own action, as well as ensuring that the health systems are strong and resilient to any crisis in the future.
You've talked about collaboration. Mr. Solomon has talked about collaboration.
Yes.
Maybe on your side, other than the AMREF Health Africa, are you like involving the community or the other partners, other NGOs?
Oh yes, very much. In fact, AMREF is one of our partners, and for your information, we are operating not only in Kenya, but we are operating in the developing world. Our presence, we are in Tanzania, and we have partnered with the Tanzanian Red Cross Society. We are also working with the World Vision in Tanzania, and Catholic Relief Services. We have worked with Catholic Relief Services both in Kenya and in Tanzania, and also we are working with other partners in Uganda, in Southern Sudan, and we have other regional offices even as far as India. So our focus is mainly in the water and sanitation challenges, that is safe water in the developing world.
Now, considering accessibility, community involvement, maybe what's the partnership ensuring that the safe and effective distribution of clean and safe drinking water?
Thank you. Yes, as I had mentioned earlier, we work through the government. We work at all levels with the authorities. We work for the communities, and with the communities being at the center point. This is the people-centered approach of our intervention. And through this, we are able to make sure that the communities are involved. And these partnerships that we are forging and we have been sustaining all this time, they are delivering impactful interventions and outcomes at the community level, so that all the health issues and other social determinants of health are addressed holistically by all the partnerships involved. And specifically during these flood situations in the areas that we have mentioned, we are conducting integrated public health emergency interventions, so that we are able to holistically address the aspect of safe water, safe and appropriate sanitation, improved hygiene, maternal child health interventions, nutrition, immunization, as a holistic manner, to make sure that we are ensuring that there is no disruption of any health issue, which is, of course, we know health and water and sanitation, all these are human rights, and we are addressing them holistically in the collaboration that we have already built.
Dr. Benjamin, we are trying to help those affected families, those flood-affected families. Maybe there is a way you guys are, the mechanism of watching the impact of your program. Maybe what's the mechanism you guys are using in order to watch or the project, impact of the project of improving the lives of those affected by the floods?
Yeah, thank you for that. As I began by saying that our products, water treatment products, they last for 1 year at least. That is the sour bag. And we do monitoring from time to time about the adoption of these products by the end users. And we have people who normally from time to time, they visit the areas where we have projects and where our partners have distributed the sour bags. And also we try to collect data. We do interviews with the end users, and we also partner with the government, that is the county government, through the health centers and hospitals, to get data about cases of like diarrhea or cholera, so that we can compare the period before the intervention, that is before supplying the water treatment solutions, and after these people have adopted the use of the sour bags, how are health issues being reported in that community or in that hospital. So we are able to analyze the data from the end users, and also we get data from public health data, so that we can analyze the impact of our interventions to the community.
Now, in terms of adaptation of the the new system of using the sour bags, maybe what are other things you guys are doing? Because wherever you're giving out those sour bags, maybe you're giving to the people from Mashinani.
Yeah.
These people, they don't have any knowledge concerning those sour bags. Maybe what are other things you guys are doing to ensure that they have full knowledge of what you guys are giving them?
Yeah, thank you for that. Yeah, you know, I say that our technology is simple. So first of all, we train our partners like AMREF. We are organizing on training the staff who will be distributing the bags. Together with that, also our team participate in the distribution and also in training. So we train both the partners on how to use the sour bags so that they can train the end users. We also go to the field before we distribute. We train the end users on how to use this system, because it is very simple. It can be understood by even the old, you know, our old grandmothers, because it's a matter of just putting your water in the bag and taking it to the sunlight for treatment. Okay. Thank you.
So much story or questions fall under you, but let me just switch a little bit. In terms of the sour bags, maybe other than the sour bags, what are other methods the AMREF Health Africa is using in terms of health-wise in order to assist those affected families? Not only the affected families, because we can see that 59% of the population are really going through tough times in terms of accessing clean water. Maybe what are other things that the AMREF Health Africa is doing?
Thank you very much for that. And AMREF, together in partnership with the government and other authorities and other actors, we are in coordinated structure addressing the flood-affected populations as well as the general population through delivery of integrated health services. And this includes the whole spectrum of wash, in terms of improved wash, access and use. Maternal child health interventions, including family planning, including the immunization, because we are there to make sure that there is continuity of services, there is no disruption of the normal health systems. We are there to strengthen the system so that the health of this population is not affected in any way. We are there to respond and fill those gaps. Yes, then at the same time we are doing risk communication at the community engagement, so that we do very purposive and targeted behavior change communication as part of preventive and control measures of any public health negative aspect, so that the community are able to understand and be able to really have knowledge and change attitude towards the preventive part of the health issues. At the same time, we are supporting the health system to intervene in curative measures. These are through the integrated medical outreaches, where we are doing treatments of the diseases. This includes the infectious diseases, non-communicable diseases, so that these communities who have been displaced and their facilities where they have been visiting has been displaced in terms of access, we are able to reach them from where they are. Then on the community aspect, we are empowering them through their structures, through the primary health care, including where we are engaging their own resource person, that is community health promoters, to ensure that they continue sensitizing the communities on the preventive and the control measures of the diseases and other health issues.
Thank you so much, Mr. Solomon. Now to you, Dr. Benjamin. We're talking about the response you guys are giving towards helping those affected families during this time of floods. Maybe what is your plan? It is flood time, yeah. But once the flood is over, what maybe are your plans, your future plans, in terms of helping, distributing the sour bags, ensuring that the community are not exposed to waterborne diseases?
Yeah, thank you so much for that, because you know, we need to look beyond the flooding situation, because as I said, we have a very ambitious aim or plan to reach 1 billion people with safe water for drinking purposes. So we are expanding our, you know, our sphere of influence within Africa and the other developing world, and we are going into partnership with organizations in international NGOs, so that we can educate our people on the need of, you know, using treated water, and also on issues of sanitation. We understand that the challenge of let's say a third of the world population not having access to safe water, it is because of you know, it is an expensive endeavor, and that is why our techniques are very simple, and our technology focuses on those people who are in the low income communities, people who are living in the slums, in the urban areas, the people who are in the rural areas, so that they can use solar, which is available. You know, the other people like here in the city, we use treated water, yeah, but the water service providers in Nairobi or in the other counties cannot supply all the people in that county or in Nairobi County with safe water. So our focus is that population which is not able to have a tap of treated water in their house. We are targeting the mamas in the village and in the informal settlement to give them a technique which they can afford, because these sour bags are they are cheap, and you know, when you buy one sour bag, it can serve one household for 1 year. And you find that one of the most, you know, strong thing about the sour bag, it is that it treats water at the household level. You know, water can be treated in the tap, but in the process of transferring it from the tap or getting it by a container like a 20-liter jerrycan or 10, there is contamination in the jerrycan. But here, our sour bags, the way they are meant, you find that there is a dispenser, so that after you treat the water, you hang it in your house and you can dispense it directly into the drinking cup. So this is what really we are using, so that we can reach out on this big population which doesn't have access to treated water. Thank you.
Thank you so much. And due to time, I think I'll allow you a bit in a short words, maybe an understanding or lame word. What is your advice towards the community in general?
My advice towards the community is to make sure that during this time and beyond, they use water which is safe, water which has been treated, because we have had reports about cholera outbreak in different parts of the country. And as for life solutions, we have a very simple solution. So we are calling upon partners and also people who come, whom we can partner together, so that we can supply these water treatment solutions, especially to the low-income communities.
Thank you so much. And maybe last chance for you, Solomon Mwaniki, maybe your advice towards the community in general.
Thank you very much. We urge our communities to adhere to the guidelines that have been already disseminated by the government at all levels, so that because all this is for the good of ourselves, and as we align to achieving the sustainable SDG number 6, that is on access to safe water and sanitation, we urge the government and other stakeholders and advocate for resource allocation and mobilizing toward this sector of water and sanitation and hygiene, because modeling has shown that if we retain the current magnitude of resources, it will take us 3 years to access the targets of the SDG number 6. So we urge all of us to put our heads together in partnership, sustain and be able to have impactful interventions on the communities.
Thank you so much. Thank you for that insightful advice, and thank you also for joining us today and talk about sustainable community solutions. At least I can see that there is something which is being done towards the community, towards helping the community. Thank you so much. To you, our viewers back at home or wherever you are listening us or watching us from, all I can say right now is health is wealth. Take care of your health as much as you would have taken care of your wealth. Have a nice weekend. My name is Zamzam Ahmed. Let's meet next time, next week, inshallah.